This is a public section of the meeting and therefore is being recorded. And I think the very first thing I want to say is that we should note the passing of Dame Fiona Caldicott, the original chair of the Council of Governors. I'm sure that's not news to people, and many will have seen the various tributes and obituaries that have come out. On a personal note, she has been someone who's influenced me for quite a long time, and obviously particularly as I joined OUH, and I'm very grateful to her for the platform that she created for us all, for our staff and our patients. And I know that many of you will have known her better than I have. So I just think we should register our thanks to Dame Fiona for helping the Trust get off to such a footing for the platform that we're dealing with today. Having said that, I think that I should just check. I'm aware that we have apologies from Gareth Kenworthy and John Harrison. Are there any others, Neil, that have come in since you briefed me?
Not amongst the governors. Tony Shapiro did send me his apologies earlier to say that he was unfortunately unable to join us, but amongst the governors, those were the only ones I had.
Thank you. We've seen Tony for most of the day because we've all been together in board and committees going through. Are there any declarations of interests that we need to record that come up? Sorry, and Simon Brewster, he came an email in just a few minutes ago, which I saw and thought I must remember to say that and forgot. Apologies. Are there any interests that need to be declared in relation to Thank you. I don't see any of that. So that takes us then to the minutes of our January meeting. I'm not alerted to any amendments that are required, but that doesn't mean that there aren't any. I don't intend to go through them page by page, but I will open the opportunity for people to raise corrections if there are any. Does anybody need to arrange any amendments or corrections? It will prove your memory if you can think back that far.
Yeah.
Thank you, in which case I think we can accept those as an accurate record.
Yeah. Excuse me, I've been...
Cecilia, yes.
Yes, may I just bring to your attention page 6, paragraph 25.25. I just wonder if we could just rephrase this paragraph, please. We've got here basically me noted the regional NHS providers meetings that the relationship between Healthwatch Oxford with the trust, I think I don't want to say with the board, it's because it's with the governors as well. And can we omit the end of the statement of that sentence where I say, where in some cases governors have never heard of Healthwatch. I don't want to publicly criticise other organisations or other council of governors. I would rather we just omitted that sentence, if that's okay.
I think that makes a lot of sense. See, are people content with those amendments? I see no objections. Sue, I missed your hand. Many apologies.
Yeah, just a small point, Jonathan. I've got the wrong constituency by my name. I'm down at my former constituency, which was South Oxfordshire. Of course, it should be Bucks, Berks, Yorkshire and Gloucestershire.
Thank you, Sue. We will make that correction and apologies for that. Okay, I think with those changes, we're okay to approve the minutes. There is one item on the action log in relation to automated number plate recognition, and I think I saw Jason with us. Jason with us? I'm not sure I saw him earlier. Neil, can you see him on the list?
I'm not sure that I can. I know he is planning to join us.
Perhaps we could ask Jason to update on where we are in relation to that when we get to items that he is with us for. I don't think there were any other matters arising, and there's nothing else on the action log, so I shall move on if I may.
Jonathan?
Yes, is that Anita?
Yes, it is. I have already emailed you with a query or a question really in relation to our involvement with Catherine as a trust with the Catherine House Hospice, and where I'd offered to be involved because of A, I was involved in it when it was first set up, and B, I live about a mile away, but you didn't reply to my email.
Sorry, that's because I was chasing up trying to understand it, and in fact Anne had clarified for me that we wouldn't be nominating a trustee, and I hadn't had a chance to read that on you. That's due to leave, I'm afraid, Anita, and I apologise, and I will send it on. But Anne, I wonder if you could just clarify the relationship with Catherine House and the work you've been putting in relation to liaising with the trustees of Catherine House. I think that would be helpful. I'm sure all governors would be relieved to know that there is a mechanism for that, even if it's not a nomination to the trustees board. Anne.
Okay, so thank you. So it is early days with the relationship, and obviously the charity now is the fundraising charity, because the operational side of Catherine House will become part of OUH. So it's the fundraising side that is the separate charity. And what we are setting up is an arrangement like we have with the Oxford Hospitals charity, where we have a regular liaison committee meeting between the charity and the hospital, with an opportunity of all sorts of people involved in the relationship with the charity. So that's the proposal, which we are about to implement from the beginning of April. So nobody will actually sit as a trustee on the Catherine House fundraising charity. So that is the position at the moment.
Anita, you're still on mute.
Because I was involved when it was first set up, and it was named after one of the former pupils at the school of which I was the principal, and was very involved with Neil Gadsby, the man, her father, who first set it up. I felt that, and because I live about a mile away, that it would be appropriate for at least one member of the governing council, of the Council of Governors, to be known to have an interest in and a closeness with the Catherine House Hospice. And I felt that my own link from the past, which is significant, should not be ignored.
So Anita, I think it's really important that Catherine House trustees retain their independence and autonomy. We've had a meeting.
I understand and I agree. Yes, I agree with that. But I would be interested for them to know that the Council of Governors of the Trust, through somebody who has been involved with them for in the past for many years, was interested to be supportive. And
I think you can relay that. We are really conscious, Anita, that Catherine House needs not to feel swamped by the trust. So it's very important that they get the chance to work through how they're going to continue their governance arrangements and the trustees, and be clear about the clinical governance responsibilities and the like that the trust is picking up. So I'm just very nervous that that it's quite a delicate process, and Anne has been holding the ring for us very effectively in terms of the liaison with the trustees, and I don't want them to feel that we're pushing things on them. So it's a really important context for that. So perhaps in a week or two, when we've achieved the transition and things have bedded down, perhaps Anne and I will brief you then, Anita, on where that relationship has got to. But we've already had a number of miscommunications which have worried Catherine House people that actually we might not be honouring that recognition of their autonomy and distinctive nature. So I just think it's really important that we take that at a reasonable pace, and I'm taking a steer from Anne on that, and we will brief you individually, Anita, but then in due course we'll brief the governors council, because it's important that they understand that relationship.
Thank you.
And there are a number of other things you'd email about, Anita, which I have followed up, but I haven't come back to you yet because I haven't got all the answers, but I'll do those out of the meeting.
Okay, fine. Thank you.
Thank you. Can I just note that we have, of course, held elections, as everybody is aware. This will be the last meeting for John Harrison, Ruth Barrow, Art Boylston, Simon Brewster and Tommy Snipe, and it goes without saying that I'm very grateful to all of those for the service, and I hope on your behalf, but if you don't say on your behalf, I'll do it anyway, be writing to them to thank them for their service, and I'm sure Cecilia may also want to say something similar at the end. We have new governors elected, and I think the details are now all available to everybody, but Sally Ann Watts from Bucks, Berks, Gloucestershire and Wiltshire, Gemma Davidson from Cherwell, Mike Gotch from Oxford City, Nina Robinson from South Oxfordshire, Giles Bondsmith on behalf of the clinical staff, and Samantha Parther on the non-clinical staff. We have an induction for the new governors on the 9th of April. Which will give an overview of the governor's role to everybody, and which is open to anybody who wants a refresher. And then we're aiming some informal virtual coffee styles so that we can begin to get to know each other after that. And I think you should have had details of that from Neil. That means that we have still with us Sally Jane, Tony, Jill, Graham and Jules. So hard luck, you didn't manage to escape us. And I'm looking forward to continuing to work with you all. I think we had a very encouraging election. It's good to have contested elections and interests. And as you'll hear later on in the meeting, we've had a review at PMQ of our membership and where we think we could hopefully have more members. So I think that's been a healthy exercise, and I'm looking forward to working with the council going forward. I don't think I'm in position to announce in the public section the commencement of non-executive directors, but I can say that one will start next week, and I will be able to confirm which one of the ones you appointed in the private session. I think the other thing I wanted to report, just by way of Chair's business, is the launch, I think it was Monday last week, of the BAME staff network, which I think is going to be pretty vibrant, judging by the variety of people elected to the network on the staff side and the way in which they launched it, sponsored by Sam Foster on the executive side, and that will ensure that staff from minority ethnic communities have a stronger visibility and voice in our decision making, which I think will be excellent. And on that connection, at the last Health and Wellbeing Board meeting, via the Health Watch group, there was a very interesting and some ways challenging video shared, some work they've done with the particular Black and minority ethnic communities in Oxford City, particularly around their experiences of access to services. I met last week with the two people from Oxford Community Action who had featured on that video and came to the meeting to try and work out how we could open up a channel of communication, and we've agreed that we will connect them with the Trust BAME network leadership so that we can make sure we hear about the experience, which was both patients and staff experience in connecting with the trust. So I think those are the sort of key activity things to report under Chair's business. We should also say, but you'll hear about this a bit later on from Jason, that you will need to remain patient about the emerging NHS. The speed at which the guidance is coming out on the planning for the next financial year is much slower than we need to have in terms of planning. And Jason will say a bit more about that. The white paper and anticipated legislation is also currently still quite unclear, but as we get the ability to brief the council on how that is shaping up, we will do so, but it isn't in place for today's meeting. So I think those are the items of Chair's business. Neil, have I forgotten anything that is supposed to be included in that?
No, Chair, I don't believe you have.
Thank you very much. In which case, are there any questions or comments around those items or things that people felt might have been there and we want to check that we haven't lost sight of? Jonathan Wyatt. You waved at me, I think, Jonathan. Did you want to say something and come off mute because you're still on mute at present?
That's it. Okay. In the light of the recent review regarding black and minority ethnics, should we get rid of the terminology which they didn't seem to approve?
Thanks very much, John. It's an excellent question, which is such a good question that we asked ourselves earlier on during the day as a board. I think the answer is essentially that is what our network has chosen to use, and we want to keep it if that's the one that they find is helpful in terms of establishing it. But when you get to individual issues, it's very often crucial that you break down the experience of different groups. So we have done that during COVID. So this is not a single group of people, but it is people whose voice we don't always have access to. So we've decided to keep an open mind on the fundamental issue, Jonathan. We're not going to go in through a wholesale change, but we do recognise the issue that lies behind that publicity and are taking it into account. So you asked a question which we explored earlier during the day for ourselves. That's where we've got to.
Very good. Thank you.
Thank you very much. Okay, in which case I think we should move on to the COVID response. And Megan, I think you're speaking to that, is that right?
Yes, Chair, I am. Thank you. So really by way of an update on COVID-19, where we are currently as an organisation, you will know that at our highest sort of peak, we had almost 350 patients in the organisation with COVID-19 and a huge number of patients requiring respiratory support, of whom, if you can imagine, level 2 care, which means not ventilated yet, there were almost, I mean, at peak, we reached almost 80. And we were operating level 2 and level 3, which is ICU service as level 3 ventilated patients in 12 locations in the organization. So that was really a huge. Today we have 8 patients with COVID in the organization, 6 in the John Radcliffe and 2 at the Horton, and we have 1 patient who is ventilated in ICU. We have found that these patients who are ventilated do take a long time before they can be weaned, and we did help both within the region and across, so within Bob and within the southeast of England, and also places like Birmingham, etc., with mutual aid in January, February. So that was a huge effort and tremendous work by all our teams, really, that saw us through that challenge. In terms of vaccinations, so our hub, vaccination hub at the OCDEM at the Churchill, we have vaccinated circa 22,000 people through there since we opened on the 7th of December. Now that is, of course, includes health and social care staff from the region, and also patients, patient groups, either vulnerable, clinically vulnerable patients or patients according to the age groups. And of those circa 22,000, 6,500 have had their second dose. So currently we are working on the second doses for the vaccines. Our testing continues, so you will know that the lateral flow tests are used for patients, but also for staff regularly, and all those who are, any of those that are positive will go on to have a PCR test, which is the nose and throat swab. Our asymptomatic testing program still continues, and we test at least 2,500 to 4,500 staff who are asymptomatic every month. which is excellent. And you will have heard from me before that all of the testing that we've made available has helped us determine our infection control policy across the organization. We are very much continuing with that in terms of make sure places have social distancing, everybody wears masks, and there's use of hand gel and Clinell wipes everywhere. Jonathan mentioned planning guidance, and we have only just received it, and very pleased to see that the first point in the planning guidance is about people recovery and an acknowledgement that staff are very, very tired. And you will hear from Terry about our own program, which is Growing Stronger Together in terms of people recovery, I think later on in the agenda. But the other things that are not surprising in the planning guidance include a focus on working within the integrated care system, linked to elective recovery, and having at least 25% of outpatient appointments as virtual, which is great. We've got a good framework to be able to achieve that, and a focus on maternity and the actions from the Ockenden report. So only other thing left to say is that all the staff that were redeployed for the second wave have gone back to their original place of work, and almost all services are back to normal, as it were. We've got almost all theatres again open and working. We just got a few things to sort out before we go back to every single theatre being open, and that's if that's okay, Chair, I'll stop there. I'm happy to take questions, but barring a third wave, we probably are okay now in terms of the updates, Chair. I don't know what you think.
Thanks very much, Megan. I'll just throw that open for comments or questions first of all. I can't see everybody, so I can see electronic hands go up, but I won't necessarily see waving. So if people do see someone waving, if that's safe to say.
I think Anita is waving.
Anita.
Thank you. I was quite concerned to read in one of the papers which we've had for this meeting, the really worrying levels of numbers of staff feeling that under the safeguarding situation, that they have been bullied and harassed, and that the percentages are quite concerning.
Anita, that belongs with the next agenda item, so we'll look to that very shortly.
Right, all right, thank you.
Cecilia? You're on mute, Cecilia.
Sorry. Megan, now this is slightly outside the remit of a governor, but you know, the doctor's curiosity takes over. With all the most amazing infection control methods that have been undertaken in the hospital, I was just really interested. Has there been a change in the other hospital-acquired infection rates?
Celia, thank you, Cecilia. So we saw a spike in C. diff during the peak, the second peak particularly. And I think somebody's mic is not muted, so there's an echo, I'm afraid. So if I just carry on, there was a change in the antibiotic prophylaxis policy, Cecilia, and particularly if you can imagine patients with acute appendicitis or gallstone cholecystitis, who both within primary care and secondary care, where the intention was to avoid surgery and treat them with antibiotics, there was a change to ceftriaxone or cephalosporins, which meant that they were at a risk of getting C. diff. But that's not the only reason, but that is one of the main reasons. So we've gone back now to changing our antibiotic policy to what it was. And many organizations in the NHS changed the policy for the peak of COVID. And then the second thing also is, trying to work in level 2 PPE in very, very intense environments and providing level 2 care and level 3 care. I think that probably did, again, across the NHS, cause some issues with long-sleeved gowns, etc., where particularly in level 3 care, the distances between beds might not have been what they're normally expected to be. And we also saw a lot of ventilator-associated pneumonia, which then led to MRSA. So we've now created a 7-point policy for IPC, which looks at all the elements. So antibiotics, staffing, PPE, literally screening, everything that then we've also made a quality priority. Hopefully we will going forwards for this year. So it'll be a real focus on preventing healthcare associated infections.
You're still mute, Cecilia, so if you're asking a supplementary, we can't hear it.
Yeah, I was just saying, I think it's a really interesting observation, because this is a new experience for so many people to be working in PPE. And in fact, the C. difficile to me, I'm sorry, I'm being a bit technical, is quite interesting because hand gel doesn't prevent it, does it? You need to wash your hands, and it's very difficult with rubber gloves on and all the rest. Anyway, that aside, that is a tiny bit medical for the purposes of the meeting. Sorry.
Thanks, Cecilia, but you will be relieved to know that Ned's have also asked questions about that as we've gone through. And this is, I think, Megan, early on we didn't really understand it, but we could see it needed to be understood, and it's good to know that we've got a sense of that now. Thank you. Megan, can I also just check, picking up the ethnic minority sort of side, my understanding is that we're not seeing a big differential amongst our staff in terms of vaccine uptake, that actually, as far as we can tell, and the data, it's not straightforward to interpret that, but we are not concerned about lack of uptake from staff on the basis of that.
No, and we've had a lot of engagement with different staff groups, a lot of promotional videos to reduce hesitancy if there was right at the beginning, etc. But as you say, the data is difficult to interpret, but we're not concerned.
Thank you. Janet?
Yes, I'm not sure whether this is a question for Mega or you can point me to the right person. And this concerns the electronic systems for appointments. We had something through last night. It wasn't terribly clear. My husband, in a complete panic, thought it was a scam. Having calmed that one down, it did actually relate, but it was an internal request at the John Radcliffe from the department for another investigation, which we knew nothing about. The information was not very clear, and I think people who are not understanding this change could well get themselves into a bit of a pickle, and I think perhaps we need to talk about it to see what we could do to improve how we identify and make sure that people are understanding and picking up their appointments appropriately.
Thank you, Janet. Yes, I'm sorry that happened, and I will, let David Wallaker, who's managing this drive for outpatient and digitization of the service, to take that into account. But I agree with you that communication is the key. Yeah,
excellent development, though.
Thanks very much. Okay, I think, move this agenda item on to the people issues. So Anita's already flagged up one of the key things that came out of the staff survey, and staff survey has already been discussed at Performance, Workforce and Finance Committee. The primary purpose for this agenda item is to brief the council on how we're going to move forward, as opposed to look at the details of the results, as the committee's already had a chance to do that. But there'll obviously be a chance to pick up that, and I suspect that Terry and Joe will already be picking up the issues around experience of harassment and bullying. I'm going to hand over to Terry Roberts, Chief People Officer, and also Joe. I'm not sure who's doing the talking on this, Terry, so I'll get you to tell me.
So Joe will be doing most of the talking, but let me introduce myself first. So my name's Terry Roberts, I'm the Chief People Officer, and I want to introduce Jo Phillips, and she's also our Director of Culture and Leadership. Now she's going to outline our people recovery plan to date, and which seeks to address a number of wellbeing issues that have come out not only of the staff survey, but have come out as a result of COVID as well. Joe will seek to gain your views on how you can help us with your partnerships and connections so that we can effectively recognise, thank and commemorate our people. So having done that introduction, I'll hand you over to Joe.
Thanks very much, Terry. Hi, everyone. I'm Joe Phillips, as Terry has just said. So I thought I'd give a little short presentation. So is that all right, Chair, if I share a short presentation first, just to provide a bit of context? Yeah, thanks. So let's hope this works. Okay, can you all see that?
We can see that, Joe.
Lovely, thanks, Jonathan. Okay. So, so as Terry said, what I'd like to do, I just want to give a little bit of context about our people recovery programme. This is a key objective for us this year, to enable us to support our staff with getting in some rest and recoverment really from the COVID experience, as well as building on the feedback that we've received as part of our staff survey results. So once I've given you the context, I'd then like us to have some time just to engage together and get your views and ideas on how we can recognise and thank individual and team contributions that we've seen this past year, as well as create opportunities for commemoration. So if you can just hold those themes in your mind as I go through the presentation, and then we can have an opportunity just to chat that through afterwards. So with regards to the context and the need for recovery, so the pandemic has heavily impacted on our people. Many have experienced exhaustion and burnout, anxiety and stress, and also what you may have heard termed moral injury. And at some time as well, we've got existing challenges that have been exacerbated. So, for example, high workload, and from our staff survey results, we saw that 37% of our staff were reporting that they work the hours that they are paid. There's also examples of people feeling that they don't have the control over their working patterns as well and their roles. And in the staff survey, 87% of our people said that they always know what their responsibilities are at work. We've also got examples around basic working conditions as well, which could be improved, and also the continued focus on safe and sustainable staffing models. We also know that as well as our people feeling stressed and anxious, some may already be feeling undervalued, thinking of leaving, or significantly less engaged. Although from our staff survey results this year, it's really promising to see that we have had some good improvements in terms of our staff engagement levels. So in terms of the aim of our people recovery programme, it's really about looking after our people, as Terry mentioned. It's not just our people though, it's looking after our people and our teams, and to really enable our recovery following the COVID-19 pandemic and our transition into a new normal. So it's about focusing on the recovery of our people, which is absolutely essential to keep us all safe and healthy at work, help reduce stress and anxiety and presenteeism, and also keep us engaged, motivated and happy at work. So we have seen a significant improvement in our 2020 staff survey wellbeing scores, including a 6% increase in people feeling that OUH definitely takes positive action on health and wellbeing. But we recognise that we need to keep the focus on enhancing the wellbeing of our people and their work experience. So our people recovery programme is really about building on the momentum that we've created during 2021 in terms of our wellbeing strategy and our wellbeing quality priorities. And it will also allow for us to build new and innovative interventions as well to enable us to continue to keep supporting our people as one team, one OUH. So in terms of the scope of our people recovery programme, it's based on the King's Fund ABC model, which shows that support for recovery needs to be wide-ranging and it needs to support the core work needs of our staff. So the ABC stands for autonomy, so that's about us having and needing control over our working lives. Belonging, which is about us being connected with one another. And the C is contribution, so where we need to feel that we're actually making a difference at work. So in terms of the priorities, we've got 5 overarching key priorities within our programme, and the first one is around meeting the immediate need for rest and recovery. So that includes examples like meeting the basic needs, as I mentioned earlier, around food, rest space, also accommodation, travel, transport, ensuring that our people take adequate breaks as well and they have those opportunities to de-stress, that they're taking their annual leave. And also a real success factor this year has been the wellbeing leads that we've been supporting over the last 12 months. And we've got over 200 now that support their teams, and we continue to offer weekly support sessions for those wellbeing leads. The second priority is around building the culture of learning, compassion and inclusion. So this includes things like trust-wide opportunities to re-establish those social connections, share stories and develop a range of ways to thank our staff. It's also around how we can create trust-wide and team events to mark and reflect the past year. How we can also recognise individual and team contributions and also the innovations and creativity that's been developed over the past year as well. It's also about developing an inclusive and just culture and embracing a culture of leading with care. So the third priority is with regards to facilitating post-traumatic growth. So there's a two-part support package with regards to this priority. Firstly, we're developing a structured wellbeing one-to-one conversation whereby all our people will have the opportunity to have a conversation with their manager to really understand the impact of the COVID pandemic and determine their individual needs from a wellbeing perspective. And also from a team perspective, we've got our psychological medicine team who have developed, based on the MOD framework, for our teams to just really get the opportunity to just take some time out and create some space to come together to reflect and recover, readjust and reintegrate together as a team following their COVID experience. The fourth priority is around supporting sustainable service recovery and workforce planning. So how do we balance turning on services and service recovery with individual and team recovery, and also how we empower our multidisciplinary teams to develop their own recovery plans based on their needs, equipping them with the tools and techniques. And the fifth priority is around building working lives that have more flexibility and autonomy. So examples are in terms of our flexible people policies, so around career breaks, agile working, home working, and also how we can build in as part of our management conversations around flexible ways of working as well. So the risks around not delivering our people recovery plan include increased rates of sickness absence due to stress and anxiety, increased presenteeism with staff attending work when they are unwell, which can then lead on to either physical or mental health problems, decreased productivity or poorer clinical care, increased turnover rates and our current workforce shortages, increased inequalities in our workforce, increase in staff claims and a reduction in staff engagement. So, in terms of our engagement, we've been founding it on a co-creation model. So we've been undertaking engagement with our people through a range of different avenues to really help co-create our sorry, the name just escaped me, our recovery programme. So that is based on evidence, it's based on best practice, and really importantly, it's based on the different needs of our people. So I'd now like to open up the conversation. So currently what we've been doing is engaging with our people on some key ideas around how can we recognise and thank individual and team contributions and innovations, and how can we create opportunities for commemoration. So if we can open it up now for discussion, I'd really appreciate hearing your thoughts, views and ideas on how can you help us with your partnerships and connections, in particular with regards to how we can recognise and thank individual and team contributions and create opportunities for commemoration. So how can you help us with your partnerships and connections?
Thanks very much.
I will stop sharing.
Thanks, Jo, and then we'll be able to see everybody.
Yeah.
Can I hold the question that Anita raised earlier about bullying and harassment until we've had a bit of discussion of that presentation, because I want to be able to do that while it's clear in people's minds. But Anita, I don't want to lose it because we raised exactly the same question amongst the NEDs when we were reviewing the results, and it was discussed also at Performance and Workforce Committee. So we do need to come back to that. But I think it's really important that we think as broadly as we can about how we can recognise the opportunities to tell people they've done a good job and work collaboratively, and that's I think what Jo's essentially asking for your ideas on. If so, open mic. remember, I can only see about 6 people at a time. So I have Rosie, and then Helen, and then Anita.
Hi. Yeah, it was very thought-provoking, and I suppose one of the problems is we're still not actually quite through this particular problem, and we're also, there's nowhere to go if you had any time or any money to do it. But presuming in the next few months we will have got through that particular stage, and without, but also recognising that possibly COVID will be here to stay and there will be a new norm going forward. But it did strike me that one thing we could do is have some charitable funds where teams could actually bid for some money to take their whatever their team is appropriate, what's appropriate for their team, whether it's to go out for a meal or to have a lunch in the department, or and it'll be different for different teams, but it will bring them together, just even being able to have the discussion on how to do it or what they would like to do. So the idea that they could bid for some charitable fund to then be able to go and do it for their department for themselves, I think might be a nice way for recollection and team building, because the COVID situation will have hit departments in different ways.
Thanks, Rosie. That's great. I take it we're not offering air miles then, because of the early bit of your conversation. I think Joe will find it most useful just to soak up as many ideas as possible. So I'm going to encourage us to go round rather than invite Joe to respond, because this is really about what opportunities are there. So Helen, you were next.
Thanks, Chair. So just to explain to everyone, and this is my first meeting actually. I'm a consultant anaesthetist in the trust. I'm a university rep on the Board of Governors, so it's really nice to be here for the first time. I'd like to thank Joe actually, because clearly a huge amount of work and thought has gone into what we are going to do. And speaking as an anaesthetist and someone who was redeployed to ICU, which is why I could not be here in January, I think the analogy with the military is interesting, but problematic, because what usually happens when one has been deployed in the military is you come back and there is a period of R&R. An actual stop, and so a month or two of doing nothing to do with work, and of course that is not possible for us. And of course actually we're going to be asked to consider stepping up the pace, because of course everyone's anxious about catch-up and about the backlog of cases. You know, we are as a clinical group anxious about it, but you're very right to point out the issues with recovery and the concern. You know, I think it's helpful, Jonathan, that you defined moral injury, because for me it was evident in my clinical practice, in the sense that I was having to make decisions around work, particularly in the middle of the night, that normally would not have to be made, decisions around high dependency care and so forth that were very challenging. I had tremendous support, you know, and I'm very grateful for it, but I think in terms of what we can do, because I always prefer to think about what we can do, prefer solutions to problems, a huge amount of work was done in our department on well-being. And I'm hoping that that's been shared with you, Joe. I suspect as well that there are other groups in the trust. I think colleagues in respiratory medicine work quite hard on well-being initiatives. And I hope that those ideas and actions have been shared with you. And if they haven't, I could certainly put you in touch with the people that have been running our own wellbeing group in anaesthesia and intensive care. So that might be helpful. I do like Rosie's idea of the funding to support recognition, because it's never about money. It's all about, you know, just saying thank you. And you know, whilst I must say I found the clapping a bit weird when it was happening, it did feel collaborative. It felt like we were being supported, but it wasn't very British, you know, so it was a bit strange to be clapped in an evening.
They could have sung as well, Helen. It would,
yeah, maybe. So that's just one aspect of it. I do like the trusts, you know, giving a day of leave. Unfortunately, my birthday's in February and I really couldn't take it then, so I think I'm going to have to save it till later in the year. But that was a nice touch, and it's things like that. And I think, being kind. You know, I bang on about this quite a lot, but the issue of kindness and compassion to each other, and how we promote that and model it as, you know, sort of senior clinicians in the organisation, but also amongst the executive leadership and non-exec leadership. The issue of kindness and listening and so forth is going to be really important.
Thanks, Helen.
Okay.
I've got a little queue, so I'm going to sort of try and cut off there. So I've got Anita next, and then Jules, and then Sally Jane.
Thank you. Am I unmuted? Yes, thank you. I because I went into the Horton today to collect the papers for this afternoon's meeting, which Caroline very kindly organised for me. And I spoke to one of the staff there and said, could I come, you know, would she be able to take me around and take me around the different parts of the Horton as a governor, and just sort of, and how would that be felt? And she said she thought a lot of people would like that, because they would feel that the governors were taking some interest in what they were doing. And I thought, well, I must reflect on this and think how to do it, you know, effectively, and so that it would be helpful and supportive. And I just sort of share that. I also totally agree with Rosie's comments as well, Rosie Herring's comments.
Thank you, Anita. We are in the process of reviewing how we can restart visits and things, because we need to do that safely without creating risks. So we will get back to you. We're doing the same amongst the non-execs who have been, by and large, limited in their physical presence and having to find ways of making contact. So we will get back to you after Easter. It will be, but you know, when we're trying to work out a plan. And one of the things we've been talking about is, can we do walkabouts which are combined non-exec and governors, so that actually that would give us a chance to look together.
Yes, that would be lovely.
Jules, you were next.
Thank you.
Yeah, I had a meeting about psychology medicine before this about how we can support my staff, and I think the only thing I'm going to say is there's some fantastic initiatives like the annual leave day near your birthday, which I think each member of staff feels like they're having a thank you. But I think however we move forward as an organisation, we need to keep it as individual, and the leaders on the ward level actually lead on what their staff need, because they've got the local information and engagement and they know their staff. So clearly I hadn't got a clue what this moral injury was. I clearly need to do a little bit of reading after the meeting, but I think I'm very key that whatever we offer the staff, it's got to be led by the ward sisters and matrons on the shop floor.
Yeah.
Thanks, Jules. Well understood. Sally Jane.
Yes, thank you very much, Joe, for that presentation. And it would be great if it could be emailed out to us after the meeting.
Yeah.
Just a couple of thoughts off the top of my head. I do know that obviously you have rest areas in the hospital and downtime areas, and that these were increased during COVID time. I'm hoping that they will be, those increased areas will still be carried on later, and perhaps there could be something to make those areas particularly special for the staff. Could be that different community groups might be able to sponsor a restroom and provide extra things. The other thing is the possibility of some sort of artwork, maybe something on a wall in the reception area, but I'm always wary that that shouldn't cost too much money. So again, that would be good if it could be done by a community group or something like that.
Thanks, Sally Jane. I mean, if you walk around the Horton, there's some fantastic photographs. I think were funded by the charity there. It doesn't feel quite the same at on the other sites, although bits of it have got some great stuff on it. So I think it's a good challenge that we should perhaps think a bit more systematically about that. Martin put in the chat that this was a good topic for discussions at the future Council of Governors. I think we'll take stock, Martin, afterwards, whether we've got so much out of this one that there's enough for Joe to be working on at the moment. Did you want to add anything to that comment?
Well, I was just going to say it was particularly on that topic of moral, can't remember now, moral damage.
So,
because I think
it's a controversial area, Martin, that there is moral distress and moral injury, and not everybody believes in moral injury, but I think pretty much everybody recognises moral distress.
Right, but I think I think it's particularly interesting in the context of the NHS as probably one of the most moral value laden organisations in the world, I would guess, and this conflict between the extreme service pressure and the high ideals, I think, is really central, probably. And I'd really be interested in hearing about people's direct experience of it.
Thanks. I think we'll take that away, Neil, as quite a good seminar topic for council governors in the future, because Simon Pragnell could come and talk about what we're doing about wellbeing, and he's probably as well placed as anybody to explain the ideas of moral injury, moral distress. What we've seen in COVID is a lot of staff being asked to do things that they're not very comfortable with, and we won't really know the impact of that until they step back from it a bit and realise what they've done. You know, they've done the right thing for patients, but it hasn't been easy for them. So they've been working in areas that they don't feel fully trained for, or looking after many more patients at once than they usually think is safe. So I think this is really important for us. So we'll arrange a decent briefing about that in the future. Cecilia, you were next in the hand, I think.
Just a quick thing. Occupational health is very, well, not ignored, but it does fly under the radar of most organisations. And I just wondered if the NEDs have inquired if there have been discussions with the occupational health teams, if they've been given sufficient support, if they require any more, because a lot of this sort of psychological damage that occurs in this sort of post-traumatic stress can take quite a while to come out, and it will be ongoing maybe for some years. So just to ask if the NEDs are sufficiently assured around the support that occupational health is getting.
So I think I can say the NEDs have asked that question on a number of occasions, and in part what we're looking at now includes the sort of response to that. I think it's a stretched service. It's stretched in terms of people and in terms of space. So it's definitely on our radar, Cecilia, but I think it would be premature to say we think it's a problem solved. I don't know if any other NEDs want to comment on that.
Yes, Katie, just to add to that, I think, Cecilia, we're regularly asking in all aspects of HR and personnel and all of these things whether there is enough resource assigned to what's going on, and Terry's answer is usually no.
Terry's going to take the opportunity to say that now.
There's always a trade-off, isn't there? And so Terry has brought some proposals to us in the last few weeks about how he's going to improve his HR team, and that's something we're always very conscious of.
So Terry, here's your opportunity to say not enough.
Well, I'm pleased to say that we have increased the numbers of staff that are going to support occupational health. And we took a case to the board, and the board approved that case. So it's a big improvement. There's at least 5 extra staff along different banding levels that we've put into occupational health. So it's a lot better. It's going to be a lot better than it has been. But there's also been support in Psych Med. So you've heard from about Simon Pragnell. He's a clinical director. The charity have also funded for there to be more psychological medicine support as well, and to specifically support our staff. So yeah, I think we're in a lot better position than we ever have been.
Yeah, that's good. That's very good.
So I think now there are a few hands that are still up, but I think they're legacy hands. Don't think there are any more contributions on that presentation. In which case, I think, Terry,
sorry,
we should.
Chair, I was wondering whether I think Janet's hand might be a new one.
I think it's an old one, but I'll just check. Is it Janet?
No, I was going to say something, Jonathan.
Okay,
something purely practical. Birthday cards with either a bunch of flowers or a small token. For the teams, you could put in bowls of fruit Or I used to find the pizza round was always quite a good way of saying thank you to people. But if we're being more healthy, we should be talking about fruit and things like that. So it's quite small things, but it actually means quite a lot of people because you're acknowledging people as individuals as well as teams.
Yeah, and a lot of that, I think, has been done, particularly through the charity, who showed fantastic initiative, I think, throughout both waves, and they were different. They had to react differently in that. Rosie, I still have a hand up, but I thought that was
yes, I put it down and then up again.
Okay,
But
sorry, I missed it coming up, Rosie.
It's just because it occurred to me, because there were two parts to the question, and one was about commemoration, and one of the thoughts that I had as to whether it was worth having a historian or archivist actually interviewing the different departments and producing a book of this year. It's meant to the different departments, the whole experience, because it's one of those, you know, I was there moments
smiling at me,
in the
because
world.
that's in hand, isn't it, Terry?
Mm.
So we have staff contributing to an ebook of COVID, so that we are capturing, for exactly the reasons that you've picked up. So suggestion. I'm conscious of time, and I think we should just take one more item on this, which is just picking up the bullying and harassment point, Terry, because it was one of the points you drew attention to when you did the all-staff briefing on the results. So I know it's in your mind.
Yeah, Joe, do you want to kick off first on the bullying and harassment piece?
Yeah, that's fine. Thanks, Terry. So I think in terms of the context, it does show in the staff survey paper that it was one of our least improved areas. But actually, this year we've seen an improvement and an overall reduction in the people actually experiencing bullying, harassment and abuse from patients, managers and colleagues. But actually the area of concern is in terms of our staff then not reporting the incident, if that makes sense. So we absolutely are embedding action around addressing bullying and harassment, but also the reporting aspect in our objectives this year across our people directorate. So some of the things we're doing is one, in terms of the investment that we've got in our new business case. So actually we're getting the resource in place now that we can really start to lead forward some of our key objectives around, you know, changing our culture and kind of encouraging more of a compassionate learning, inclusive culture. Leadership development is going to be big for us as well. So we're currently designing a new leadership behaviours framework, and that's going to be within that civility is going to be, you know, weaved throughout it. A just culture as well, so people are treated fairly, is going to be within that, but it's all based on our 6 trust values, which include compassion and respect. So we're going to be taking that forward this year as well, and starting to embed that over the next few years in our whole employee cycle, really. But actually the just culture is going to be a big objective for us, which includes civility saves lives as well. So it's what we can do to just really one, review our policies to make sure that our staff are being treated fairly and compassionately, but actually how we also create that culture where people are having those just-in-time conversations, you know, nipping things in the bud. When you see something, how, you know, you can actually then have a coffee and a chat and just speak to someone in terms of how they are as well, you know. So there's a big initiative that we're going to be doing around all this, because we are very clear that it is a priority for us this year.
So just to be clear, whilst our bullying and harassment scores have been reducing, getting better, we still think that they're too high, and we will be taking action to ensure that we deal effectively with any bullying and harassment that takes place.
Good.
Okay, I think we should move on from this item. I'm sure we'll return to bullying and harassment, if not before the staff survey next year, certainly at the staff survey next year, and see how we've gone. We should now move, and we'll need to try and catch up a bit of time for everyone, I think, to the Q1 budget and annual planning. I'm hoping the good news, Jason, is you can't tell us very much because of where we are in relation to the planning cycle, and we'll catch up a bit of time. You also need to pick up the number plate recognition matter arising, which I'm briefed that you'll be able to tell us where we've got to. Jason.
Thank you. from my perspective, it's not good news that I can't say to you very much, because it means that we're on the last day of the financial year and we don't have this quite where we'd like it to be. But Jonathan's right, we shouldn't allow too much discussion, and we should work out when we can talk again. The planning guidance for the first 6 months of the next financial year was actually released on Thursday, with some of the templates that we need to populate and detailed information being released on Friday and Monday. Hence, you won't be surprised from probably about 100 pages of documents that we haven't digested it, packaged it up, and are ready to tell you exactly what it means on a Wednesday afternoon. And we still don't have the trust level financial allocations. The deadline for submitting a draft plan as an ICS is in the first week of May, with a final plan in June. There are some big departures from previous years, and they're going to have implications for trust and ICS governance, including the role of governors. I just haven't worked it all through yet. So in previous years, we had to produce a trust, activity, workforce and finance plan. This year, we still have to produce a trust finance plan, but the activity and workforce planning submissions are entirely being done at an ICS level, although I believe there will be some trust level detail in them. And actually, there's not a requirement for trust board sign off on them, and they are clearly an ICS plan. Interestingly, and we don't know the answers yet, in the detail of the planning guidance, there's a reference that the FT Code of Governance, the document on duties of FT governors, and a few other technical documents are going to be amended in the year to reflect a slightly different governance framework. Now, you'll know that we have a statutory duty to engage with you on the forward plan. We're no longer really required to produce a forward plan. In fact, there's no opportunity for us to give one. It's an ICS plan. I'm hoping that these amendments to some of these governance documents will guide the board and the governors at OUH on what the requirements are. I think the spirit clearly is we will go away and do some rapid thinking now, looking at your timetable over the next 2 months, so May and June, before that that ICS final plan submission deadline in the first week of May. We'll do some rapid thinking on how to engage with governors, because I think, and I haven't cleared this with Jonathan, so he'll mute me if I'm speaking out of turn, but I'm sure we would want to, even if some of the regulations will change, we will, I'm sure, want to work with the spirit of the regime, which is that we engage with governors, and we will work out, ideally without asking you to meet for an extra meeting, how to use a committee or seminar or other slots between now and the end of and the start of June to engage with you. So that's the process.
Just to confirm, Jason, I think there's another reason why we need to do that, which is that we need to keep reinforcing to the ICS the importance of having appropriate public engagement, so we can demonstrate how useful it is through working with the council. That will help that.
I didn't think I was speaking out of turn. I wasn't very worried that you would mute me there. Just a minute or two on what the guidance says to us. So there is rather more emphasis than in last summer's guidance on maintaining a level of resilience for a continued level of COVID disease in the community and in the hospital. Not strictly speaking quantified, but there's a bit more emphasis on maintaining that resilience. The focus, at least for an acute trust like ourselves, is very much on our workforce. Another big, perhaps presentational, perhaps substantive change in the guidance is the first section of the guidance is about planning for our people. So historically, NHS planning guidance start with either the money or the activity, and the planning requirements on the workforce and people are a bit of an afterthought. This year, the people section comes first, so there's a huge emphasis, and I won't repeat it because actually everything that Terry and Joe have talked to you about, we are already, at least in broad brush, actually working on the things we would need to do anyway, so I won't repeat what's in there. There are a few things that are new. On activity, you won't be surprised to know that the fundamental requirement is actually to try to restore elective patient volumes to a high percentage of what we were doing in the 2019-20 year. And that's in the first few months of the year, with an idea to building on thereafter. And we are simply just working through at the moment how much of that we can do. I think Sarah Randall and her team have got a pretty ambitious plan in place. On the finances, we're required to break even. I should say we don't yet know how much income we're going to get because that's much less clear than normal. We obviously understand our current costs, and Sarah and I, working with colleagues, have a good grasp on how much extra money we might spend to bring waiting lists down. And then we're broadly being asked to plan for a fairly stable level of urgent care demand. We have locally set draft quality priorities, which I think one of your committees may have seen, and we'll find an opportunity to engage with you on. And as I say, we'll find a way to put it all together if needs be with an extra meeting. But I'm hoping Jonathan and Neil and others that we'll be able to take one of the other meetings that's in the governor's calendar to do that engagement before the start of June. And that's my update.
Thank you,
Should I do ANPR now, or do you want to allow any time for questions?
Let me just check. I want to sort of discourage questions that can't be answered, because I think there's very little Jason will actually be able to elucidate beyond that, but I don't want to discourage you raising questions that he might be able to answer. Is there anything that we think Jason might have a chance of answering at this stage? Janet, your hand is up, but I think it's an old one.
No, I did take it down.
It just doesn't seem to disappear when you try. And Sally Jane, similarly, I can see your hand, but I think it's an old one.
Yep.
Okay, I think then, Jason, let's move to the basis of that not having lots of questions is that you've undertaken to bring to us a briefing in due course, so that we reserve the right to ask you things at that stage. The automated number plate recognition, please.
Yes, well, I have some rather good news here. So, obviously, the governors were aware that 2 years ago the board authorised an ANPR installation. It went rather slowly even before COVID because we were having difficulties finding a contractor we were happy with, and we weren't happy with the cost estimates. Half or more of the total cost of about £1 million were actually going to be digging up trenches around our sites to lay cables, and a number of members of the executive team have been asking the parking team to try and find us a supplier who could use wireless technology. And we managed after Christmas to find a supplier that will do that. We have purchased most of the equipment. We think the costs will be between a third and a half of what we previously estimated because much less trenching is required. The installation will be taking place between, well, some of it started and between the late spring, and we should be live in the summer. That will cover the John Radcliffe and the Churchill, I think. The Knock parking is run by the PFI company, and at the Horton we've relatively recently installed some contactless machines, so we're going to let the JR system bed down before we decide whether to replace the Horton machines early. And just picking up one of the threads that governors have asked about in the past, at least initially the system will be operated for us by the parking operator who the new operator who we brought in last year after a tender, because we weren't happy with some of the quality of our previous parking enforcement support, which is sometimes overly heavy-handed. And I know governors raised with me before that one of the things we should be very mindful of, obviously, is to make sure that the operator is not incentivized to find non-compliance. And we're happy with our current operator, at least in the respect of they're not being incentivized in that way.
Thank you, Jason. Can I discharge a deluge of it isn't really true in the meeting? And if you do know staff who are not experiencing that, then perhaps you can let Jason know.
It is important to know that ANPR will principally operate over the patient and visitor car parks. So national policy is that staff car parking will remain free, and we have to ration car parking because there's not enough space. But if you are allocated a parking space and if you park legally within the allocated parking areas displaying a free permit, then parking is free for staff. I should also say that today's intended to be my swan song on parking, because I handed over the estates brief, including parking, to Sam Foster last summer. But in preparing for this meeting, I thought that since I had started it on the ANPR journey, I would offer the update. But in future, actually, I will put Sam up to talk about parking related questions.
So if you're particularly nasty, he'll duck out earlier. David, your hand is up.
Yes, I just wanted to make sure that we were looking at the methods of payment. I raised that in the PMQ last week. Currently, what happens isn't working, and it needs to be thought through again.
And this is because people have to have change with them.
Yeah.
Yes. Jason, reach you.
The whole point of ANPR is that both contactless payment is possible, but also actually if you're a frequent visitor for sites but not covered by a concession for free parking, you can arrange, for example, to have your bank account debited when the camera recognises you on site. There's a variety of options, but the system will be positively set up to, it will allow cash payment, but will be positively set up to actually make cash payment as is not the default option anymore. So I think, David, it will more than satisfy the concern you raised last week, which was passed on to me in preparing for this.
Yeah, just, one always needs to bear in mind we have a huge range. I mean, our demographic is about as mixed as it can possibly be.
Absolutely. I'm conscious it's almost 5:15. I think, can we move on from this item to the external audit contract, which is, I think, a straightforward recommendation from the audit committee, and I'm hoping that sorry, Rosie, you wanted to come in on that. Is that still parking?
I'm sorry. Yes, it was.
Yes, no, that's fine. I didn't.
It was the thing about the being heavy-handed, and I'm glad to hear that they've changed the supplier. But at the very least, could we ask for a report on any on difficulties and appeals to come to the governors when it has started and bedded down, just to see what the issues are and just to check whether we think they're being heavy-handed and not quite as accommodating as they should be to patients, so that we don't get a deluge of complaints from
Jonathan, if I may, I think it'd be entirely appropriate to give the governors an update on ANPR and other major developments in parking. I'll go away and leave it probably with Sam, but we should be very careful about how we can discuss complaints with the governors, because you can discuss ball statistics, but my experience when I was running estates, a small number of the most sort of challenging complaints or appeals reached me, and in general terms that is both emotive and the facts are a bit muddy, and the small numbers in that case, and it really would be quite a tricky conversation to actually have with any detail at a forum like a governors meeting, actually. But the principle of actually reporting on how successful the implementation has been, including whether complaints, for example, have gone up or down directionally and in volume terms, I think should be fine. But I'd be cautious about getting into appeals.
So, Jason, I think the action from this is that governors should receive an update on the implementation of NPR and associated parking matters, and then Rosie will work out how we can do that once we're a bit clear what the process is. We'll also take back the question as Ned's about how we get assurance on the appropriate management of that, but I don't want to answer that question on the hoof. So Rosie, it will come back, and I'll agree with Sam what how long it takes before we can reasonably take stock of how we're doing on that. Thank you. Rosie, I take it that's okay from the fact you haven't let back in? Either it's okay or you're still on mute, Rosie.
Yes, absolutely fine. Thank you very much.
Thank you. So the next item is the recommendation from the Audit Committee that we extend the contract with Mazars for external audit. Paula, do you just want to talk us through that quickly?
Yes, I will. Thank you very much. Just to provide a bit of colour, I'm really conscious that the appointment of the external auditors is an appointment made by the governors, and the external auditors sign off the audit of our financial statements each year, and also a value for money assessment on us. I think the paper is pretty clear. Mazars' appointment comes to an end this May, and there is a provision to extend it for a year, which we would very strongly recommend that you do. To provide the context, bearing in mind the pressures that everybody has been under over the last year, 12 months ago, we took on board as a trust new counter-fraud advisors. That's gone very well, and we're investing quite a lot of time now with them to develop our counter-fraud arrangements, and that takes a lot of time with the team. And Jason and I had a really good update with them just last Friday, I think it was. This April, we are onboarding new internal auditors who look at our internal systems of control. And Jason and the team, and indeed all the executive directors and their teams, need to invest time in making the most, getting the best out of that contract, and we are committed to taking that time as well. I would have to say that therefore changing the external auditors this year as well is probably not an ideal move, and we would very strongly like to extend Mazars as we can perfectly properly under the contract, and then we would aim to renew that, or to recommend that you renew that next year. The other thing that helps that is that, as is said in the paper, which has come from the team, that the team, without in any way compromising the independence of the external auditors, the team have found working with Mazars to be a good experience. Jason and I, and indeed Anne's on the line, and Katie, my fellow audit committee members, can testify to the independence, having gone through last year end and all the challenges that we've gone through with COVID. So I think we're quite comfortable. There's no compromise there. But they have found working with Mazars a good experience, and we would very much like to continue with that for a further year. So that's the background, and it just helps to support the recommendation that you extend for 1 year in accordance with the contract.
Thank you very much, Paula. And then there would be market testing after the extension.
Absolutely, yeah, absolutely.
May I take it that unless anybody has concerns, that we're happy to accept that recommendation coming through?
Rosie's got her hand up, Jonathan.
Sorry, I can't see that now.
Yeah,
Yes,
it was just actually making a point from another trust where they had to go out to tender for external auditors, that they found it very difficult. There is not the breadth at the moment or the interest. So I think it's very, very sensible if we can possibly extend for a year, and maybe things will have settled down in the marketplace a little more by the time you have to re-tender.
Thank you, Rosie. I remember that sentence or two being almost precisely said at the discussions, Paula. That part of the rationale for this is the market is not strong at the moment. We hope it'll be stronger by the time we go out. Thank you very much, Rosie. So I think then the council has agreed that recommendation, which is firstly the extension of the year, and secondly the market testing at the appropriate time later on in the year.
Yes, agreed.
That now takes us to item 9, which is the Constitution review, which you'll have seen from the agenda is scheduled for only 5 minutes. That's because an enormous amount of work has been done by, first of all, Susan Paluca, who will answer any difficult questions if there are any, but even more importantly by the working group that Sally Jane chaired, and then through Governor's Patient Experience Membership and Quality Committee. Particular mentions in dispatches, I think, to Martin and Cecilia, as well as Sally Jane on that. This has been to the board already and has approval on the recommendation from the Governor's work by the board, and I'm encouraging you to agree it as well, because then they can take immediate effect, and a lot of work has gone on. It's a long bit of the paper, but colleague governors have worked very hard on knocking this into shape, and Susan has gone through various iterations to take into account feedback. And I think, Sally Jane, we now thought at PMQ this is in fit state, and you would be supportive of us approving this second phase constitution review. Am I right?
Yes, we support that as the group who met. Yes.
Absolutely, agreed.
So may I take it, Jonathan? You're still on mute at present, so we'll await.
Yes, Chairman. What I was concerned about was the rise from 5% to 25% of the matters that would come before the Council of Governors. it seemed to me a huge leap, 500%. And this would probably mean that many less matters would come to the Council of Governors. And if I looked at 5% of the, so to speak, turnover, with the American experiment, and I call it that for significant reasons, which didn't succeed and did lose some money, that came to the council. Now, with this lift up, perhaps such matters wouldn't come to the council, and I would have thought they were matters which should have. Turning to the question of other trusts that have had lifts up to 25%, the reason I think that Bristol had it was because they were compressing into 2 sites, and one site of development had to be disposed of and was worth a large amount of money. So I accept that everybody has worked jolly hard on it, but I wonder why it was moved from 5% to 25%. Could anybody comment on that?
Thanks very much, Jonathan. I'll hand over to Susan, I think, to comment on that. Should bear in mind that there are a number of things that bring stuff to the council, and there are issues around approvals in the forward plan as well as the thresholds. Susan, we went over this in quite a lot of detail in the process, and you also did comparative work, so I'm going to hand to you at this point.
Yes, thank you. If Jason is still with us, I certainly will defer to him for any further detail.
He's not going to leave now.
But just to clarify, and I sort of take the point if this hasn't been sufficiently clear, but in fact, there are 2 thresholds that the group looked at in detail, and the one for what would count as a significant transaction was already 10%, not 5, 10%, and that's the threshold that it's proposed be lifted to 25%. The threshold of 5% remains as applies under statute and is universally adopted. I couldn't find a single trust that didn't use it, for that being the threshold for an increase in non-HS activity. I think, without putting words into Jason's mouth, that in all honesty, the threshold for a significant transaction, if you look at the turnover of the OUH, the figures are such that even a threshold at 10% is not going to capture that many transactions. And the much more important emphasis and work, I think, is being concentrated on developing the mature engagement between the board and governors. We've heard, of course, the coming changes in planning guidance that's going to affect engagement on the forward plan of the trust specifically. But heartened to hear that the principle will remain of wanting to engage fully with governors on the full planning process, if I can put it that way. So I would characterise it as being the threshold of 25% being in line with practice of all other comparable trusts that we looked at, but also that it's not the only device by which engagement should and must happen with the governors.
Jason, do you want to comment on that as well before I go back to Jonathan?
Well, I mean, Susan's summary is obviously completely factually correct. So in terms of the question, it's really important to understand that the 5% threshold for non-NHS activity still applies. The only gloss I was going to make was really to emphasise what Susan said about both the spirit of engagement and the forward plan engagement, because actually the American project actually didn't come to the governors for approval. It wouldn't have needed to. It was the total investment was 1%, less than 1% of the trust's income at the time, would be less now. To scale it for governors who don't spend as much time as I do thinking about the trust income, even 5% of the trust income would be £60 million. And I think the governors would be quite upset if the board did something at £59 million in non-NHS income areas and said we weren't going to tell you about it because it was just below the 5% threshold. So it's quite hard to believe actually that we would ever do a single project that would have a 5% increase there. And therefore it's just, I think, particularly important to focus on, as we have done for the last year or two, actually on wider engagement on, for example, commercial strategy, which we've done, on the forward plan, and even on talking to the governors about potentially interesting projects that are way below those approval thresholds, but we still think they'd like to know about. That's just my gloss. Susan's update was, however, of course, completely factually correct.
Thanks, Jason. And colleagues will know that as part of that openness and transparency, we have a private sector item where we're just briefing on where we are going with the commercial strategy in that spirit. Jonathan, does that answer the question?
So do I assume that big decisions and consultations are not being removed from the Council of Governors by this change in the Constitution?
Yes, you're correct to assume that. It's not intended to remove anything. There are sort of three tiers. So the 25% it deals with divesting of resources and things. That's not like the American project. The American project wouldn't have been caught by the 5%, but the 5% is not changing anyway. It is caught by the commitment as part of the forward look of consulting with the Council of Governors, and we are very clear that we remain committed, as we did as part of the review of the American project, to keeping governors involved at an early stage. And indeed, we'll see some of that in a few minutes' time once we've dealt with the public business about just updating governors on where we are in terms of thinking around the commercial strategy that they were previously briefed about. So I think, Jonathan, I can assure you that there's no intention to keep stuff away from the governors that would have previously come as a result of these amendments.
Chairman, I think I'm satisfied from the explanations I've heard, but I wouldn't want to have, in several years or a year and a half's time, want to have been subject to a pincer which said, why didn't you bring this up? It was a 5 times increase.
Absolutely, and I wouldn't either, Jonathan. So we'll if that were to happen, we would both have been out.
Thank you, Chairman.
I'm not sure who was first, Rosie or Sue, but I have Rosie and Sue's hands up. Rosie?
Thank you. My issue is item 5 on the termination of office of a governor, and I just wanted to ask if there could be a slight amendment to the wording, and I hold my hands up and in confession, and it wasn't this trust, but I nearly ended up being booted out because I'd duly given notice and apologies for one Council of Governors meeting which I was unable to attend, and then my father died, and I have to say that I completely lost the plot and didn't even know that I'd missed a Council of Governors meeting, and I could have been fallen foul of missing 2 consecutive meetings. And all I would ask is that the head of corporate governance, the chair, takes reasonable efforts to contact the governor to establish whether the absence was due to reasonable cause.
Rosie, is that not covered by the fact that you can only terminate a governor if there's reasonable cause? So were I not to make that inquiry and make an attempt to do it, you would just draw that to my attention, and I would realise that I was being unreasonable. So I think that is covered by that. Susan's nodding at me, so she thinks it is.
If that's your understanding, that's
is my
fine.
understanding, Rosie, and I think that can go in the minutes of this discussion. So we would then have it clear.
You would contact somebody and then establish what the reasons were to establish that they were reasonable. Thank you. That's covered. Thanks.
Thank you. Sue Willicott.
Thank you, Jonathan. Mine is in the same area as Rosie's, actually. What's going to be the situation of governors wanting to remotely take part in meetings from now on? Bearing in mind that a lot of companies are saying that their workforce can work from home, are we going to enshrine that in the governor's constitution, or is it going to be played by ear, or what's the situation?
So Sue, I don't think that's suitable for in the Constitution. It is something we currently have under review, and I think we need to discuss. We're discussing it at the board level about both board meetings and committees, and I think it's the council will need to work through its working practices. I think learning from COVID would suggest that we would need to aim to be flexible, but we'll also have to work out the logistics of doing that effectively. I would be very unhappy if we locked ourselves into a particular way of working in the Constitution that then gets superseded by good working practices. So I think what I'd like is, if you agree, is that we note that attendance means different things in the modern world, and it may not be just physical attendance. We're all attending the meeting at the moment, and so I think I'd like to hear that separate from the termination provisions, but I absolutely accept that we need to have a discussion about that. There are mixed views on the call, Sue, about whether we should be rushing back to face-to-face or whether we should be continuing to work remotely. So I don't think we should take a decision until we've had a chance to give people the ability to discuss and reflect on the options.
All right, okay, as long as it can be recorded somewhere that, this was discussed. I mean, I'm thinking more about when we actually are able to go back to face-to-face meetings. Not everybody wants to do that, not necessarily because of COVID, but also travelling difficulties as well, and parking difficulties. And I wouldn't want to see governors actually debarred from taking part in meetings just because they couldn't physically present themselves.
I agree that we need to, for lots of reasons, we need to work that out. It isn't that easy to do hybrid meetings, so we need to have a chance to work it out.
Okay,
I think. Thank you. Susan, is there anything you wanted to add to those discussions? Because all I'm going to claim, I think, is that we don't need to alter the drafting, but we just need to record in the minutes those points that have been raised. Would you be comfortable with that, Susan?
Yes, certainly. Thank you, Chair. I'd put my hand up but the answer has been given. So really, all I'd like to take the chance to say is a huge thank you to to the governors who took so much time and trouble in careful and detailed consideration of these issues, for the support that came from, in particular, the Vice Chair and the Chief of Assurance, and I think governors were pleased to have input from the Chief of Finance too, and of course, I may say, Chair, for you championing the importance of this work. So thank you, everybody.
Thank you. The thanks that you've just given to other people pale into being insignificance in relation to the thanks that we have for you, Susan. So I'm sure Neil's minutes will reflect that adequately. So I think then we are agreeing these amendments. We are noting the discussion around the thresholds and the commitments we've made to honour what we said previously about fully engaging with the Council of Governors on our commercial strategy. We've noted the importance of taking active steps to assess reasons for non-attendance as part of the question, should it arise, about absences due to reasonable cause. And I think we could also put into that category the point that Sir Willicott raised, that the sense of what is reasonable and what counts as attendance depends on our working practices. And if we were to create a meeting that made it difficult for governors to attend because of the mode of meeting, that would obviously need to be taken into account. But those are things relate to the Constitution. There's a broader set of things about good working practices going forward that we will pick up in due course. Thank you. That, I think, was the set of issues around the Constitution. We have opportunity, Cecilia, to talk about performance, workforce and finance. There may not be many things that we haven't already covered, so I'll just check with you whether you want to add anything to that, Cecilia.
Thank you very much, Jonathan. Just to say, we had a meeting which was well attended, and Terry and Jason were there as our EDs, and we had a good number of NEDs. We reviewed the staff survey results, and I must say we had a very thorough discussion around those, and certainly sought the NED assurance that we were looking for. Also, Jason briefed us on the financial forecast. Perhaps the key thing to bring out there is that the committee heard that for one-off reasons an underspend was predicted, quite surprisingly, and that work was underway to pull forward spend where possible, where good value for money could be demonstrated. We had a discussion around this, and I'm sure Jason will come back to us at some point about this, but that's all I'd like to report. Thank you.
Thank you very much, Cecilia. I can confirm that discussions will be continuing about spending money in alignment with our strategic objectives and where it's value. And indeed, we had a private board meeting earlier today, just looking at the latest views on that, and that will come back to in due course. Sally Jane, patient experience management and quality report. Obviously, the constitution bit we've seen. The opportunity to report on our recent meeting.
Yes, thank you, Jonathan. As you said, a lot of our time last year was taken up with the Constitution review, and we had our first meeting back as a PEMQ committee last Friday. And we received a report about how the board collect reporting and assurance about patient experience. We discussed the ways in which the board collect this information, but also hoping that as governors we might be able to build on that. And so if you have any ideas, perhaps you could let us know in due course about other ways that views about patient experience can be collected, particularly from perhaps those hard to reach groups, and other ways that we can gain a full picture of patient experience. As regards membership, we looked at the trust numbers, both as a whole and divided into gender and then age and then ethnicity. Because of COVID, obviously the usual means that Caroline does an amazing job of recruiting new members haven't been possible. So the membership has dropped a bit, and there's a desire to move it back up again. And of course, this again is where we as all governors come in to try to sign up new members to the trust in any way that we can, and to bear that in mind. Caroline can give you all the details, and if you want the paper copies of what to do. And we were also looking at ways of boosting membership, looking at the numbers in Oxfordshire, trying to make sure that 1% of the population in each of the constituencies are members. So that little bit of work needs to go on that. And again, of course, building on membership from the harder to reach and seldom heard groups as well. So all ideas welcome, and please use all your contacts to try and build up the membership. And then finally, for quality, we had a look at the interim review of the board's Integrated Assurance Committee, and also had a look at their latest report. And that's very much the committee is making its way, and we will watch this space for further views about how it's all going.
Thank you, Sally Jane. On my screen, I see hands from Sue and Rose, Sue Willicott and Rosie, but I think they just lingered on my screen, and it may not be because they linger on there. My Teams, I think, is playing up a bit on that. Can I just check that they're not questions on this? I'm not seeing.
No, I've lowered hand.
Thank you very much. In which case, then I think we received that report. I don't have any other business, and our next meetings are scheduled on the agenda. And so I suggest that we end the public session of the meeting with lead governor business, and I'll hand over to Cecilia.
Thanks very much, Jonathan. Basically, I just wanted to thank all the outgoing governors, John, Ruth, Art, Simon and Tommy. I think I certainly can see Art. I don't know who else is here. Basically, you've contributed so much to many aspects of the work of the council, and with grace and humour, you'll be greatly, greatly missed, I must say. And we wish you all the best in the future, and hope you stay in contact. And it's been a great pleasure for all of us working with you. And to say my own little piece, really, just that I think the Council of Governors has matured greatly. The work of the appointments, particularly the chair and the new NEDs, has had very positive results. And I feel that there is a much better trust and understanding between the board and the Council of Governors, and you've all played an incredibly big part in that, and thank you so much from us all.
Yeah.
I second, third, or would have got to on that. Thank you very much, Cecilia. I think there's not more that we can really say than that. So thank you very much, everybody. We reached the end of the public session at this point, which means that the recording will stop. But there are a couple of items of confidential business.